Hello and welcome back to my channel. Today is another speech pathology appointment where we talk about more of the details of how I'm developing my voice through speech pathology post glottoplasty surgery. If you have any questions or comments, please leave them down below and I'll be happy to answer them for you.
Hi!
Hi!
How are you?
I'm good.
I
Feeling great.
didn't see you there right away. Have you been here for like the last 10 minutes? No.
Yeah, well, 9 maybe?
Okay, because it just like, I was sitting here looking at it and looked at something else and you weren't. Anyway, whatever. We're here now.
I had a couple of issues at first and then I had to reload. I don't know if that caused anything, but...
Okay. I like your braids.
Oh, thanks.
How have things been going? You came in to see Dr. De Niro last week, I think, right?
That's right, yeah. And apparently it opened up a little bit, so like I guess the larynx, when it was healing, opened up a little bit. He said that's normal. Maybe mine did a little bit more because I can now go into the lower tones that I guess you normally wouldn't be able to do otherwise. So I don't know if I need a revision or not, but it's probably not healed enough to know.
Okay. So what's the plan moving forward as far as
Just to see how it goes. I mean,
okay.
where it is now actually sounds okay. So, but I have noticed like when when I do get more tired, then I start to go into those lower things that sound really gravelly. So, but I have been practicing. I've been doing a lot of really long phone calls.
Yes.
So.
And then how have those been going?
Fine, really. I mean, well, obviously I got kind of tired in one of them. I keep the pitch meter open while I'm doing that, just so I can keep track of where I'm at.
Okay.
So for the most part, I can stay above 150, but occasionally it gets down to like 140, 130.
Okay. And what's your effort level for staying about 150 at this point? Like
I mean, there's still effort. I can't just relax.
Yeah.
So, I don't know, maybe 4 on a scale of 1 to 10.
Do you feel like the effort piece is getting easier the more you're practicing?
Maybe.
Okay. Okay.
It's kind of, it's hard to tell, and it's hard to tell how much more it's gonna change as it heals too. Like, it's kind of, I just don't know.
Yeah.
You can see, like, it sounds like I get that kind of vocal fry sound a lot.
Okay. So right now, as you're talking, are you making an effort to modify your voice?
Yeah.
And then, okay. Okay. And then what sorts of things have you been practicing? Or what are you sort of thinking about? I know we've talked about like the lip spread and thinking about, keeping the larynx higher.
Yeah. Well, and I've been trying to practice the kind of things, like, or the swallows. Sometimes I forget, but yeah, it does help when I do it, for sure.
Okay. Which are the things that you find the most helpful out of all the things we've talked about?
Probably the
Yeah. Yeah. I think that roughness, graveliness might be related to the healing. Um, just because I don't think you necessarily had that before
I didn't,
um,
no.
in your voice. And
Yeah.
I was looking at, I mean, I didn't see the actual exam, but there were some screenshots. And there was still kind of it looked like some redness um, right.
I was trying to find, they're not in the computer system, I guess, because I went to this system, this clinic that's not in the system, computer-wise.
Mm-hmm.
So, and I didn't get to see them there, which I was kind of disappointed about. Um, so yeah, I don't know what it looks like. It's just what he's told me.
Oh, did you not see it on the day of the exam? Or you
No.
just, oh, okay. That's weird. I feel like usually they're pretty good about. Yeah, as I'm looking at it now, it just looks irritated and kind of right at that. So you have your vocal cords, and this part kind of in the middle, the mid-membranous zone, the
Yeah.
striking zone, that area has redness, there's hypervascularity. So usually when that area is irritated, that can produce some roughness in the voice. So I think
Yeah.
that's
That
what
could
that
be it.
is.
I mean, also just that it's pushed together. Like, it definitely comes out if I use the lower tones. So like if I talk down here, where I used to be, then it's always really gravelly.
Mm-hmm.
But, you know, I guess normally I wouldn't normally be even able to do that.
Yeah. Um, yeah. So for that, I would say just in order to maximize healing, I would just try to avoid like pushing beyond what feels comfortable as far as, well, in two ways, as far as length of time talking. So you're talking about longer conversations, but if you get to a point where you start to feel fatigue or discomfort, you
Yeah.
know, trying to stop before that point or as soon as you feel that. Um, and then another thing I would say is maybe not aiming for anything that's too high that requires like too much of an effort. I was listening to the recording you sent me where you did the three
Oh
different
yeah. Hmm.
voices, and you know the second one I think is sort of where more or less where you are at now and where you were
Yeah.
kind of as you were narrating through it. Um, and then the last one you I think referred to as potentially a goal.
Well,
But I think
they're all
that
possible, honestly. I mean, like I don't talk up here just because I don't feel like it sounds really good and it doesn't feel like me, but it's really not any more effort. Well, not a lot more effort anyway than just talking here. So, or even down here. Well, down here, this is where it's kind of relaxed. So I guess this is around 150, 140 at the button line.
mm-hmm,
So that's where it's the most relaxed, like right around here.
mm-hmm, yeah. It just, to me, like that higher sound sounds a little bit strained. Um, not necessarily when you did it just now, but what I heard in the recording is just a little bit more like breathy, and I think it would be
Yeah, I don't
hard
want to
to
sound
maintain.
strained.
Yeah. Um, so I think just also as you're like still feeling around about where you want it to land. Um,
Yeah. Well, I think I know pretty well now, like around 200 to 220,
yeah.
maybe. That's kind of where I want it to be. Um, and if it goes down to 150, that's okay as long as it doesn't go below that.
Mm-hmm. Mm-hmm. Yeah. And that second one, I did the analysis on it, and the average was like 195, and the range was 170 to 230. So I think that's like a pretty good
Yeah.
place, because it's not. Yeah, whereas the last one, your average was 297, which is really high. With the range being between, actually, I think maybe this was it may have picked out some background sound or something, because it said the highest part of your range was 441, which seems really high. So I don't know if it just like picked up some like ambient sound, but in any
yeah,
case,
I don't know. There are little bits that kind of it picks up sometimes and goes all over the place. But I can go up that high if I'm like when I'm singing. That's about as high as I can go, 450.
how is it when you're singing? As far as like controlling pitch or
It's
the
getting
quality?
better. I can control a pitch much better now than I could before.
Okay.
So it's like it's more steady. It's not really wavery like it was,
Okay.
going all over the place.
Okay. So stability is better, both in talking and singing.
Yeah.
But then we still have some of that roughness.
Right. Yeah.
Okay.
And I don't know. I suspect that is from the separation, but I don't really know
Oh, from where
it's separated.
Okay. Yeah, it's hard to tell. I would have to look at them side by side, to see like how far, like how much it separated.
Yeah.
But yeah, that's actually a pretty good point. That's probably where.
Well, when I saw it right after surgery, it looked like he had closed about 55% of it.
Yeah. Okay. Okay. Let me see if I can just real quick find the initial post-op. So that would have been.
That was December 8th, I think. 28th, pardon me, December 28th.
December 20th is when you had the or when you. Okay, hold on.
December 20th was the surgery.
Okay. It doesn't have pictures on this one. Okay, so yeah, there was an appointment with him on the 27th, but there's no pictures on that one.
Okay.
So I can't really compare. But when I'm in the office, I can usually look at the exam. Did you see him at our Fontaine office or at Pantops?
Well, for whatever reason, they put me to Pantops. I didn't ask for that, and it's kind of been a disaster because they are not connected in the same way. So I asked to be at Fontaine for the next one, but that's 9 months out. And I thought, I don't know if we need to, we can let him know that I need to see him. But
Okay, yeah.
But when I was there, it sounded really good. It sounded okay. So, and for short periods, I can control it really well.
Mm-hmm. Okay, so now basically it's dealing with the roughness and then maintaining the range where you want to be, or the two.
Yeah, right.
Goals.
Because we tested my range with him, and I think it went from 130 to 480 or something like that. I don't know. Maybe 430.
Yeah. It says, let me see what it says here. It says 175 to 438 on your glides,
Okay.
and then average pitch 217.
Yeah.
And volume 62 decibels, which is pretty good. Do you feel like you have any issues with the volume piece? Like projecting or being heard?
Yeah.
Yeah.
That's definitely a problem.
Okay. Do you feel like that's a problem when you're at your target pitch or just anywhere in your pitch range?
Um, if I'm way up there, I can punch it out more.
Okay. Interesting. Okay.
So like talking to Google Assistant in the car, I have to pitch it way up. Um,
Like, can you demonstrate what that sounds like?
oh, um, change the radio station.
Okay. Okay. So you can't get that volume at where you're talking right now.
Yeah.
Okay. Interesting. Okay, so try just saying, hey.
At what pitch?
At your
Oh.
at your
Okay.
pitch where
Hey.
you've been talking. Okay.
So yeah, it's like it's not loud enough for my stepmother to hear me.
Okay. Like to hear you yell, or if you're just in conversation, she can't hear you.
No, if she's not paying attention to me,
Okay.
then she'll be able to listen to hear it. But her hearing is kind of isn't great, but it's also associated with her attention. So if she's focused on you, it's a little bit easier. But even so, it's difficult. I mean, speech to text is much more difficult now than it used to be.
Okay. Okay. All right. What if we try? I don't know how well this is going to work, but this is a technique to help get a little bit better vocal cord, I can talk, closure, and a little more volume. And it kind of utilizes some of the stuff that we've talked about before to help with pitch, like high tongue, high larynx, but it's this sort of more bright, brassy sound, which we're just going to try it out. I know aesthetically you might not like it, but the idea is we'll just kind of see how it affects all of these things, and then we practice it at like a 10 out of 10, and then we kind of dial it down. But I want you to try saying meow.
Meow.
Mm-hmm. Meow, meow.
Meow, meow.
Mm-hmm. Meow.
Meow.
Okay, now try quack, quack.
Quack, quack.
Quack, quack.
Quack, quack.
Mm-hmm. And try ew. Ew.
Ew.
Uh-huh. Good. And now try nee, 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 nee.
Nanny, nanny, nanny.
Okay, good. And back to the meow.
Meow.
Okay, and now just say meow.
Meow.
Okay. But meow just like you're speaking it. Meow. Meow.
Meow. Meow.
Uh-huh. Do you feel a difference in how you're producing one versus the other?
Yeah. I guess the second one is more relaxed.
Which one's more relaxed, when you're just speaking it?
Yeah.
Okay. Do you feel, so you're feeling like certain muscles kind of engaged, but does it feel uncomfortable or tense doing meow, meow?
Meow. No. It's just
Okay.
it's just a different throat position, kind of.
Mm-hmm. But do you notice how it's louder?
Yeah.
Uh-huh. um, so basically, what you're doing on the inside when you do that is creating a narrowing above the level of the vocal cords. So we don't really want to put pressure or narrow right at the vocal cords because that's what causes strain. But narrowing right above the area right above that kind of creates a tube within a tube. And so it makes the sound brighter and smaller. So kind of what we do when we try to change the resonance with that high larynx position, but it also is that narrowing of the
Yeah.
space.
That's right. So how would that work? Like, cause, cause like it's really high up there. I mean, it's really high.
Right. So so there is a difference. So part of it is a higher pitch, but when you said meow versus how do I do this, you weren't still in the twang. You just had the higher pitch, but you didn't have that kind of squeeze, because I can be at this pitch without the twang, but then when I add the twang, it kind of changes. And so basically, the way we do this in a hierarchical way is like you start out with a meow, 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 and then we're gonna meow into some words like meow, meow, 1, 2, and you're gonna try to keep that kind of narrowed position. So try that meow, meow,
Meow meow.
meow, meow, 1, 2.
Meow meow. 1, 2.
Okay, good. Meow, meow, hey you.
Meow meow. Hey you.
Mm-hmm. Meow, meow, no way.
Meow meow. No way.
Mm-hmm. Now try meow, meow, hey ma.
Meow meow. Hey ma.
Okay. So I want you to do the meow again. Meow.
Meow.
Mm-hmm. Hey ma.
Hey ma.
Uh-huh. Okay, now try it a little bit lower in pitch. Meow, meow, hey ma.
Meow meow. Hey ma.
Uh-huh. Okay, good. It's almost another reference point for me when I think about this tone is, I don't know if you ever watched Friends, but there was a character on there, Janice, who was, no, okay. What about The Nanny? Have you seen that show?
No, I do know Fran Drescher, but yeah, no,
Yeah. So it's
not
that
super
kind of like,
familiar.
Mr. Sheffield, like that.
I don't think I could even do that though. Not that I wouldn't want to.
Well, okay. I'm not trying to make it sound like Fran Drescher. But sometimes having this mental reference point for what you're aiming for helps you find the target.
Sure. Yeah.
Or sometimes it's more like, okay, I'm thinking about high larynx and high tongue and that kind of meow.
High larynx and high tongue, like that.
Mm-hmm. Yeah. Yeah, like that.
So I think I can do that. I don't have to. I think Fran Drescher is not a good model.
Fran Drescher's not a good one for you? Okay. Let me see what else I have here.
But that's kind of. While I want to keep it up there and keep it fairly bright, I think there's a balance to that too. Like I just want to sound like an adult woman, and for someone of my size, I think it's more appropriate for it to be further down because, sure, I could be up in the 300 hertz zone if I was, 5 foot tall or something, but I'm not.
Okay, right. I see what you're saying. Or, it's SpongeBob, is that a helpful one?
Oh,
Like,
I know. I've seen a few episodes.
um,
I just actually started watching them because it's become a point of cultural reference, and I've never seen them because I never had kids, so
I
it's like,
don't think it's for children. I think that like what I've seen of it is like it's really weird.
well, most of those shows, if they're successful, they're for adults and children.
Mm-hmm. But there is this there are some that seems like they're specifically made for adults, like the I
You're
don't
right.
know,
I
like
mean, I can see your point there because there are parts of it that, yeah, it's like it is bizarre.
um but I think the or Roadrunner like me
I
like
mean,
finding that sound. I think that will help practicing that. I'm gonna send you some stuff to practice and walk through and see how it feels. But I think that could help even with that, like take away maybe some of that breathiness that comes in as well. Because what it does is it helps you get more volume and it helps facilitate better closure of the vocal cords and for longer. So it helps them approximate and stay together
okay.
longer. Basically, if they're just kind of barely touching, you're going to get more of that airy voice, which is what I do hear a lot in you. And I don't know if that's something that you want to have, so we don't
Yeah,
necessarily
well,
have
I want some of it, but not too much of it. But I guess, um, yeah, my audio model is actually an aunt of mine who does have that a fair amount, but it's not completely, you know. Um,
to.
so there's definitely a balance there, and I don't want to overdo it.
Yeah. Um, because that I think the breathiness can, well, for one, it can make it harder to get loud if you're in, because when you're breathy, basically you're having barely, like, very minimal vocal cord contact. So it's kind of like a stiff cord. Um, and so it's harder to get that volume. And it also sounds a little bit more young, I think, potentially. Like, not like child like it can if you like over like if you were like this obviously again it's totally up to you, but I just think that having having that a little bit is okay, but more it can potentially be like
No, I'm fine
make
with
it.
pulsing out. Um, and
And I don't think where you are is like way too far or anything like that. Like, I don't think you sound like a child when you're doing this, but I just think like we can play around with some of this stuff and see like what both what sounds good and what feels good to maintain. Because maybe incorporating some of the twang will make it easier to stay up there with less effort.
yeah, I have noticed if I do a little bit of this kind of sound, then it's easier to keep it up there. Um,
Mm-hmm.
which is, in a sense, it's helpful because this is one of the standard female accents that people make.
Mm-hmm.
Not my favorite one, but it's okay.
When you say accent, do you mean like a tone?
I've noticed that there's multiple kind of accents that women do. Like women say words differently than men
Uh-huh.
do. Um,
So not you don't mean like regionally or
no,
just okay.
no, it seems like it's more like a family thing or a time period thing.
Mm.
Like like my grandmothers, they talked like this kind of. It was way up there, kind of twangy, but then like later on in the '60s, they were all more breathy, and then they got into the '90s and they got kind of buzzy.
Mhm. Yeah. Yeah. Um, yeah, and there's a certain like melody, I would say, that you often hear. I was just um, traveling abroad and I noticed I could just pick out Americans really easily. Or a certain, or I could be like, okay, this is like someone from this region. That was just like, and then I told her that like it's this very like kind of all over the place. That I was like, I don't know that I like that, but it's very recognizable.
Yeah, well, and that happens worldwide too. Honestly, you can go all over the world, and women will have kind of, you can listen even if you don't understand the language. You
Yeah.
can hear that women and men have different ways of speaking.
Mm-hmm. Mm-hmm. Yes.
Sometimes even a whole other language. But
Yes. Yes. Um, yeah. So I guess part of this process for you is probably just trying out some of these different things
well, it's
and
also what I can do
figuring.
now. I guess what I was going for is kind of like the more breathy thing, but really I kind of want to be kind of neutral at this point after the surgery. Like if I can go for the neutral, and then maybe I can sort of start adding things in. But um, I think including some of that is a really good idea, just because it helps signal to other people that this is a female voice.
Mm-hmm. Yeah. Yeah. And it's, again, you can play around with adding it or taking it away. And also, like, there's calibration. Like, I feel like when I model it, I try to really add it in there and make it obvious. But I also know that even as I listen to myself, I don't like how that sounds. And so I don't want you to think that that's what I'm trying to get you to go for. But I think that could be helpful. And it also a
No,
little
yes,
bit.
you sound very neutral, which would be fine if I can get there.
Oh, you mean like when I'm talking
Yeah.
without the twang? Okay. Got it. Got it. Yeah. What was I going to say? Also, when you're practicing some of the meow, 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 it also gets some of that like thyroid tilt,
Hmm.
that like
Hmm.
kind of sweetness helps practice with that as well.
Yeah, it really does.
And that too, that like as the thyroid tilts forward, it also helps get better closure. And so it's going to the voice sounds a little bit fuller, not quite as breathy when you add
Right,
that.
so if we can get it to be less breathy, I think that sounds better.
Yeah, yeah. I think it's just like going to require a fair amount of thought and I think mental effort more than anything. um, which,
It seems to be getting better.
yeah, yeah. I hope you feel that way because I know a big part of why you wanted to do the surgery was to lessen the mental burden of it and the physical burden. So,
Yeah,
I
which is kind of
think,
why that's why I'm wondering if I need to get revision. But like I said, it's probably not healed enough to even know that yet. So
yeah. And did he advise on any kind of timeline for that, or he just
no.
sort of, okay, okay. Maybe I can chat with him about that as well. Just might
Yeah,
be
just
helpful.
keep up with him, and I think that would be good because you spend a lot more time with me than he does.
Yeah, yeah, um, yeah. It's just the piece of like surgical things and healing and tissue and edema, like all that stuff. Like he has a little bit more experience with, and so,
Right? Yeah.
um,
Well, that's kind of what he was saying. Like you just need healing to a large extent. So if we can get through, it's I have a schedule to see him like a year after the surgery date, but
mhm.
whether we need to see him before then, I guess we can kind of work on.
Yeah.
It would be
Sounds
nice.
great.
I mean, I talked to him about it, like, that I can go lower, but I can actually. It is a lot easier to keep it up here. So
Mm-hmm.
in some sense, it worked, but it's it might need some adjustment.
Mm-hmm. Do you feel like it's gotten, I know you said it's easier overall, like I'm assuming compared to before surgery to keep it higher, but say in the time since surgery, has it gotten harder? I'm just wondering if like you
Yeah,
have felt
it
a
has,
change
but
as
it's also
that.
been. It has gotten easier, but it's been so hard because it didn't really do much but squeak when I at first.
Right,
So, but it was when I was
right.
first out of surgery. Then I was up around 250 hertz, and that's all I could do.
Mm-hmm. Okay.
So,
Yeah. There's just a lot of, yeah, and at that time the vocal cords are more swollen, so there's just like a lot of moving pieces
exactly. Yeah.
to keep track of and figure out where it's really going to settle in. And so at this point, you are 3 months out, a little bit over 3 months out. Oh no, because you were beginning of December, so four almost.
Yeah, 3.5, 4.
Okay.
So it was
Okay.
December 20th. So, yeah, 3.5.
Okay. I think from what I have read, and I will kind of check in with him, is like the 6 month mark is a pretty good indicator
Yeah, that's what I was thinking.
of
Okay, yeah.
where it's settled into as far as the healing. Um, so that can be a good time to kind of
Yeah.
reevaluate and think about whether you want to do any kind of revision.
Yeah, maybe it would be a good idea to set up an appointment with him for that. Um, but we can keep working.
Yeah, yeah, absolutely. Okay, so I'll send you some of the stuff to incorporate twang into your practice. And then, what have we been doing up until now? Like every 2 or 3 weeks? Oh, crap. Where am I? No. Okay. So about 2 weeks. Um, but I think at this point, let me see. It'll probably end up being around 3 weeks till I can see you. I'm gonna have our scheduler reach out, and well, one of my colleagues is out on maternity leave, so it's made our schedule very
Okay.
packed. But so maybe because of that too, I will have her. Okay, so you'll be at the 6 month mark. May?
June.
June? Okay. So I will have her make 2 more appointments, which will probably end up being both in May. um, and then we can evaluate at that time
Okay.
kind of where you're at and what you're thinking as far as a revision or what makes sense for therapy moving
Yeah,
forward.
I mean, and just maybe it'd be good if you checked in with the doctor and
Yeah.
let him know.
Yes. I will shoot him an email.
Okay.
Um, I know he's on vacation this week, but
Okay. Yeah. Well, I mean, it's not a rush, but um, yeah, that would be good.
yeah, it's always helpful to, because we read notes, but sometimes, especially the doctors don't always like fully finish them. Right away, they'll put in like the most relevant things, but not like the full assessment. And so, or also it's just sometimes easier to just talk about it than try to decode all the notes. So yeah, I'll definitely plan to check in with him before our next session.
Okay, great.
Awesome. Okay, so I'll email you. I'll have a schedule 2 more appointments, and then we'll go from there.
Sounds good.
Okay, have a good rest of your day.
You too.
Okay,
Bye.
bye.
May you be well. May you be blessed. May you be filled with unconditional love for all beings. May you feel unconditional love from all beings. May you be truly at peace. May you be perfectly healed. May you be perfectly well. Aloha.